Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about myopia, also known as nearsightedness, why it's becoming more common, what actually causes it, and what you can do to protect your vision or your child's vision as it changes over time. Here's what we'll cover today. We'll start with what myopia is and why it develops. Then we'll look at why it's becoming so widespread worldwide. After that, we'll explore how it affects daily life, how it's diagnosed, and what treatment and control options exist today. Towards the end, I'll share what I hear most often from patients and families navigating these changes. Myopia means that distant objects look blurry while near objects remain clear. If you imagine your eye like a camera, the goal is to focus light directly onto the retina. That's the back layer that captures images. In myopia, the eye grows slightly too long from front to back, or the cornea is too curved for the eye's length. That causes light to focus in front of the retina rather than on it, and this leads to blurry distance vision. This usually starts in childhood and often progresses throughout the teenage years before stabilizing in early adulthood. Genetics do play a role, so children with one or both parents who are nearsighted have a higher likelihood of becoming myopic. But lifestyle is shaping the modern landscape in a big way. More time spent on screens, long hours of close work, and less time spent outdoors are all linked to increasing rates of myopia in children and teens. One important point is that myopia is not caused by weak eyes, and it doesn't mean your eye health is failing. The eye is simply growing in a way that affects the focus of light. That said, higher levels of myopia can increase the lifelong risk of certain eye conditions, which is why early management matters. Let's talk about why myopia is becoming so common. Around the world, we've seen a dramatic rise in childhood nearsightedness over the past few decades. Many researchers believe this is connected to how we use our eyes today. Kids and teenagers spend a great deal of time reading, on tablets and computers, looking at smartphones, and doing near tasks for long stretches without breaks. At the same time, they're spending far fewer hours outdoors. Natural light and long-distance viewing play an important role in healthy eye development, and without them, the eye is more likely to elongate. Parents often ask whether screens directly damage the eyes. It's not damage in the traditional sense, but prolonged near focus encourages the eye to adapt to that distance, especially during growth years. This is why moderation, breaks during close work, and outdoor activity are so important for children. Now, let's look at how myopia affects daily life and how it's typically diagnosed. Most people notice that road signs, classroom boards, or distant faces look blurry. Children may squint, sit very close to the television, or hold books close to their faces. Some complain of headaches or eye strain after schoolwork. A comprehensive eye exam is the best way to diagnose myopia. During the exam, we focus on how the eye focuses light, and we check eye health to ensure there's nothing else contributing to the blurriness. Routine eye exams are especially important for children because their vision can change quickly, and catching those changes early allows us to manage progression more effectively. Now, let's talk about treatment and myopia control options. The simplest and most familiar approach is glasses or contact lenses, which correct the focus of light and make distance vision clear again. Today's prescriptions are highly precise, comfortable, and easy to update as vision changes. In recent years, we've also developed effective measures to slow down the progression of myopia in children. These include specialized contact lenses designed to reshape how light focuses in the eye, daily disposable lenses with specific optical designs, and prescription eye drops that influence how the eye grows. Each method works differently, and the best choice depends on age, lifestyle, and how quickly the prescription is changing. For adults whose prescriptions have stabilized, laser vision correction procedures like LASIK can also be an excellent option. These reshape the cornea to correct the way light enters the eye, allowing many people to see clearly with glasses or contact lenses. The EVO ICL is also an excellent option for adults whose vision has stabilized. What's important is understanding that myopia management today goes beyond simply correcting blurry vision. we now aim to guide eye growth in younger patients to reduce the long-term risks associated with higher levels of nearsightedness. From the patient's perspective, I hear many similar questions. Patients often ask, is there something we could have done sooner? How fast will this progress? I reassure them that myopia is extremely common, and in most cases, it's manageable and not dangerous. What matters most is monitoring it regularly and using proven strategies to slow progression when appropriate. Adults often tell me they've worn glasses since childhood and wonder whether their myopia is too severe. In most cases, we can correct vision very effectively, regardless of prescription. And many are surprised to learn how much comfort and clarity improve with a properly updated prescription, especially if they've been stretching an old pair of glasses a bit too long. So here's the takeaway. Myopia is one of the most common vision conditions worldwide, and it's becoming even more widespread in young people. While it can be frustrating or inconvenient, it's very treatable. And today we have excellent tools to both correct vision and slow its progression. Whether you or your child is experiencing changes in clarity, a routine eye exam is the best first step towards understanding what's happening and how to manage it confidently. Thanks for watching Eye Health Insights. Take care and see you soon.